The subtle signs on your ears that could reveal your risk of heart disease and cancer. People are being advised how ears can reveal a lot about people's general health and are not just there for hearing. The main function of ears is for hearing and balance, but they are also affected when someone is unwell, and even the shape can give an insight into their health. Anyone who has had an ear infection is aware of how sensitive they are with a feeling of being bunged up, dizziness, or having tinnitus, the buzzing noise in the ear. And surprisingly, the health of ears can also warn of serious illnesses including heart disease and cancer, which means many people should pay a lot closer attention to them. But advice from the NHS is not to try cleaning ears, as that could actually cause more problems. It states, your ears are self-cleaning. The skin in your ears acts like a conveyor belt. It travels along your ear canal from your eardrum, bringing any debris with it. Sometimes this conveyor belt motion does not work very effectively, so you need to have your ears cleaned out by the practice nurse at your GP surgery or by the oral care service. If you use cotton buds or anything else to clean your ears, you can disrupt the ear's natural cleaning system. Often the only thing this achieves is to push the wax further down the ear canal, making you feel deaf temporarily and causing damage to your ear canal or your eardrum. Here are a list of 6 health conditions that people can discover from their ears. Heart disease. If you're under 60 years old and have a diagonal crease across the earlobe, it could mean you're at greater risk of coronary artery disease, CAD, which can cause heart attacks, according to some studies. The diagonal wrinkle, also known as Frank's sign, has been seen in the likes of Steven Spielberg and George W. Bush. But it's important to know that it is not a sure indicator as to someone has the disease. One theory suggests that an earlobe crease is linked to the loss of elastin and elastic fibers in the skin, the same process that damages blood vessels in CAD. Other, more common symptoms of heart disease are chest pain, shortness of breath, pain throughout the body, feeling faint or feeling sick. The best thing to do is contact your GP if you are worried about any symptoms. High blood pressure. Ringing in the ears or tinnitus could be caused by many reasons, and it includes high blood pressure. Often it is not due to anything serious and could be simply due to listening to loud music, but at the same time people should be aware that tinnitus is often reported by people who suffer from high blood pressure. Fungal infection. If someone has itchy ears, then this could be due to a fungal infection like Aspergillus or Candida, which grow and spread in the ear canals. Other symptoms of Aspergillus can be yellow or black dots or white patches, and for Candida it may lead to a thick and creamy white discharge from the ear. Generally, people with these fungal infections can have earache, flaky skin around the ear canal, and possibly headaches or tinnitus. Breast cancer. While having earwax is normal, there are certain textures that should be looked out for. Typical yellow wax in the ear can even be beneficial to an extent, as it prevents bugs and dirt from getting inside, but if it is wet and sticky, then people should take note. Research suggests that this could be the sign of a mutation on the ABCC11 gene, which increases the chance of developing breast cancer. A study found that Japanese women with wet earwax had a higher relative risk of developing breast cancer than those with dry earwax. However, it doesn't necessarily mean that if you have breast cancer you will develop this symptom, or that you have breast cancer if you already have it. Whether you have wet or dry earwax depends on your genetic makeup. Wet earwax is more common in people of African or European descent, while dry is more common in people with Asian background.